Measuring the amount of glucose in a blood specimen is one of the most frequently performed blood chemistry tests in the medical office. The test results are used to detect diabetes mellitus, hypoglycemia, and liver and adrenocortical dysfunction. Blood glucose is usually measured when the patient is in a fasting state. The patient should be instructed not to have anything to eat or drink except water for 12 hours preceding the test. The patient should be scheduled for the test in the morning to minimize the inconvenience of abstaining from food or fluid. The medical assistant will show you how to perform a fasting blood sugar test using the Accu-Chek Advantage glucose meter. Before proceeding, sanitize your hands. Assemble your equipment. You will need the glucose meter, a container of test strips, a lancet, an antiseptic wipe, sterile gauze, and an adhesive bandage. Check the expiration date on the container of test strips. Before running a test on a patient, 2 quality control procedures must be performed. They include calibration of the meter and running controls. The medical assistant will first show you how to calibrate or code the glucose meter. This must be done each time you begin using test strips from a new container. Calibration compensates for variations that occur in the manufacturing process of the test strips. The meter is calibrated using a code key that accompanies the container of test strips. Insert the code key into the slot on the back of the meter. Push on the code key until it snaps into place. Turn on the meter. A 3-digit code number appears on the display screen. The number must match the code number on the container of the reagent strips. As you can see, the code number is 635, which matches the code number on the container of test strips. Next, the medical assistant will show you how to run controls on the glucose meter. Running controls ensures that patient test results are reliable and valid. 2 levels of controls must be run each day before you use the meter for the first time. You must run a level 1, or low control, and a level 2, or high control. First, check the expiration date on the control solutions. Remove a test strip from the container and immediately recap the container. Gently insert the end of the test strip with the silver-colored bars into the test strip guide with the yellow target area facing up. With this model, inserting the test strip automatically turns on the meter. Check to make sure the code number matches the number displayed on the container of strips. When the strip is correctly inserted, a blood drop symbol flashes on the display indicating it is ready to accept the control solution. Roll the level 1 low control solution between the palms of your hands to mix it. Press and release the right arrow button once to select the level 1 control. Next, apply 1 drop of control solution to the edge of the yellow target area of the test strip. After a short time, the control result is displayed on the screen of the glucose meter. If the control result is within acceptable range, the result will alternate with the word OK on the display screen. If the low control result is within acceptable range, it will fall within the expected range listed on the test strip container. As you can see, the low control result is 59. The expected range on the container indicates the low control should fall between 18 and 64. This means that the low control is within acceptable range and that patient test results will be reliable and valid. Next, you must repeat the control procedure just demonstrated using a level 2 high control. Press and release the right arrow button twice to select the level 2 control. Next, apply 1 drop of control solution to the edge of the yellow target area of the test strip. As you can see, the high control value is 315. The expected range on the container indicates the high control should fall between 270 and 324. This means that the high control is within acceptable range. Record the control results in the quality control log. As you can see, at the top of the quality control log sheet, you must record the name of the meter, the lot number and expiration date of the test strips, and the code number of the container of test strips. You must also record the lot number, expiration date, and expected range for each control solution. On the bottom of the log sheet, record the date, the low-level and high-level control results, whether or not the results are within acceptable range, and your signature. The medical assistant will now demonstrate the procedure for performing a fasting blood sugar on a patient. Begin by sanitizing your hands. Greet the patient and introduce yourself. Identify the patient by full name and date of birth and explain the procedure. Ask the patient if he has had anything to eat or drink except water for the past 12 hours. If so, it could lead to inaccurate test results. If the patient is not in a fasting state, consult the physician for guidance. Open the gauze packet and allow the gauze to rest on the inside of its wrapper. Remove a test strip from the container. Promptly replace the lid of the container to prevent the strips from being exposed to moisture, as this can lead to inaccurate test results. Gently insert the end of the test strip with the silver-colored bars into the test strip guide with the yellow target area facing up. Check that the code number displayed matches the code number on the vial of test strips that you are using. When the strip is correctly inserted, a blood drop symbol flashes on the display, indicating the strip is ready to accept a blood specimen. Cleanse the puncture site with an antiseptic wipe and allow it to air dry. Apply gloves. Perform a finger puncture and dispose of the lancet in a biohazard sharps container. Wipe away the first drop of blood with a gauze pad. The first drop of blood contains tissue fluid that could lead to inaccurate test results. Gently massage the finger around the puncture site until a large drop of blood forms. A large drop of blood is needed to completely cover the target area of the test strip. Now you are ready to collect the blood specimen. Comfort Curve test strip is being used to collect this specimen. For this type of testing strip, you must touch and hold a drop of blood to the edge of the yellow target area. Completely cover the yellow target area. You will hear a beeping sound when sufficient blood has been applied. If the yellow area is not completely covered, apply a second drop within 15 seconds of the first drop. If more than 15 seconds elapses, you must start over with a new testing strip. Place a gauze pad over the puncture site and ask the patient to apply pressure. After the blood is applied, an hourglass flashes on the screen while the meter analyzes the blood specimen. After a short time, the result appears on the display screen. The test provides a direct reading of the amount of glucose in whole blood in milligrams per deciliter. The fasting blood sugar result for this patient is 110 milligrams per deciliter. The normal adult range for a fasting blood sugar is 70 to 110 milligrams per deciliter. Remove the test strip from the glucose meter and discard it in a biohazard waste container. Check the puncture site and apply an adhesive bandage to the patient's finger if needed. Remove your gloves and sanitize your hands. Chart the results. Include the date and time, the type of glucose test, the glucose test result, and when the patient last ate. Abbreviations to use for the type of test performed are FBS for fasting blood sugar and RBS for random blood sugar.